Since 2018, RAM has continued to grow and build on Stan's legacy and his passion. We've gone to Alabama, Alaska, Colorado, Idaho, Iowa, Massachusetts, Minnesota, Pennsylvania, South Carolina, and Vermont. These are all states that weren't even on our radar. And now we've had multiple clinics across those states, and we look forward to going back and helping take care of our neighbors.
Have you been to an event like this before, or is this your first time?
Yeah.
Wow.
Didn't know what to expect.
Yeah. How's it been for you so far?
Yeah. Good. Everybody's like really nice.
The line's a little long today, but you guys got in here quick, so that's good.
Through our growth, we have been able to create different avenues for patients to receive care, whether that's expanded women's health services, dental services, or vision services.
I never thought I would end up where I'm at today, helping to lead this organization. What we've done is we've narrowed our focus. We are strategically focused on providing free healthcare through our pop-up clinics here.
People ask a lot, did the pandemic change the need? I think it just created the opportunity for more need to exist and more reason for RAM to get to communities to provide that care. We hosted an event in Cookeville, Tennessee, which was kind of our last official event before operations needed to shut down. The country shut down, schools were shut down, dental offices were shut down, because COVID was wreaking havoc across the nation. March is when we really kind of hit our wall with COVID. Prior to COVID, we were doing around 100 events a year.
We had our eyes set to get these events happening in every state across the United States.
You know, COVID threw a curveball. So our team kind of came together and said, look, we're going to have to change our process. We're not going to be able to have 500 people standing in a crowd at a gate as we're calling numbers. So what can we do? And what we came up with was a tent system and a custom-built side that gave us visibility into the room that also had ductwork built into that tent side that gave us the ability to run negative air pressure into the operatories. Negative air pressure using a HEPA air scrubber purified the air about every 45 seconds in a room. We knew we were onto something that could help us keep operational. It was in August when we really did our first test clinic with that system.
I'm here volunteering with Remote Area Medical. I was here on Friday to help with setup and was ridiculously impressed with how Remote Area Medical has made things COVID compliant.
From August to September, we did a couple micro clinics that were just testing the process. And at the end of September, we went back into a full clinic operation of dental, vision, and medical services all at one.
It goes back to what Stan so often said, is how do we get this done? The question, can we do it, is never even addressed. When we go to these new states, a lot of times it's come from volunteers who've come to us and they said, hey, you know, why can't I do this in my backyard? States' rights and licensure, such as it is, state by state, and they go back and they garner those licensures. And we bring everything needed.
My name's Rishi. I'm a senior at Duke University. I graduated just a week ago. First clinic that we're hosting, it's actually the first clinic in North Carolina. They've been trying to do a RAM clinic here for a long time now, and it's been quite a journey. Since then, we've brought a chapter of Remote Area Medical to Duke University.
What's this stuff? So that was your previous measurement on the website. So, yeah.
At my school in Suffern, New York, Suffern High School, I started the RAM Club, which now has about 50 members, and me and a good group of friends are pretty passionate about it. And 4 or 5 of us made it to Virginia this weekend.
When I first started this journey, New York was this huge wall. It's impossible to do clinics in New York. You know what? I can't keep track of the number we've done in New York. What are barriers for healthcare? Well, in the United States, one of them is like access. If I don't have a car in the US, I'm in trouble. So we've invested in telehealth, where we can take the telehealth out to the community.
So we have a couple different telehealth models. The first model is literally from home. Someone can access a doctor via their iPad, their telephone, or their computer. They're able to call, schedule an appointment, get online, see a doctor face-to-face through a video call. The doctor can do full medical exams, wellness exams, sickness exams. They can evaluate prescription medications and also check the health.
I think it makes patients feel more secure when you reach out to their own home. They're comfortable there. And then they can actually chit-chat with them on the computers. And sometimes that's all you need. Somebody's willing to listen.
Second style is through a mobile health deployment. Currently we have a unit called D1. It has 2 exam lanes in it. And we bring all the technology and the volunteer providers. So we'll have nurses and general support staff. We'll take this unit and set it up in remote areas. By doing that, we're able not only to take the doctors to the remote areas, but we're also able to alleviate the barrier of technology.
It's another wave or a next wave in healthcare, and I'm very excited about the fact that we can reach as many people as we do in such a short period of time. So I like it because we can go into areas where there is a need and do it quickly and a little bit more frequently.
I think that model is going to be a very successful model, is provide doctors to patients in their area. It's a win-win for everyone. We've also expanded in some of the ways we deliver service. In 2018, we had a conventional denture lab in our office. That denture lab was able to provide dentures for patients geographically close to our headquarters. It required patients to drive into our headquarters for follow-up seatings of their dentures, and that process would last 2 to 3 months per patient before they left with a full set of dentures. We're currently in the process of building a digital denture lab, and in the next few weeks, that digital denture lab will be on the road. And the benefit that it will have for us is we'll be able to take an impression of a patient in a morning of a clinic. We'll be able to design and then 3D print dentures, and that patient will leave the same day with a brand new set of dentures.
There's no difference in quality, no comfort, performance. It's like, okay, we got this.
I love stepping into clinics. You know, like my driving factor for getting into RAM was making a difference. You know, it's almost palpable, the difference that you can make. And for me, it's still fulfilling and engaging every time.
It feels very foundational to like my formation as an eye doctor.
There's something gratifying about being able to help your fellow citizen and American. You don't really understand how much need is right there in your own home city.
The need continues to grow around this country. The need for medical, dental, and vision care is only becoming more and more. More and more clinic requests are coming in day to day than we can even put clinics on.
I hope that y'all can continue to, do this and things don't get shut down again.
My mouth is gonna feel beautiful after this. It is really needed. I really need these feelings.
It's touching, and I appreciate your compassion, and I hope that more people can learn about this.
The need has always been there. It's not really changed. It's just our ability to meet that need has grown through things like donations and volunteerism.
Join our student volunteer group, go on RAM trips. They'll change your life. You'll get tons of practice on your skills in.
We need more interpreters next year. We need more dentists. We need more opticians. We need more volunteers.
If you want to volunteer or if you want to donate to RAM and help us out, ramusa.org is where you start. There's a drop-down box, I think it says, I want to volunteer for RAM. And the other one is I want to donate to RAM. Or I want to bring RAM to my community. Pick one, or pick all 3.